Hi, Dr. Gary Frenette here. And if you're watching this video, you've already watched our general chemotherapy teaching video. And as you know, that provided a broad overview of the multitude of drugs that we call chemotherapy. There are many drugs, all of which are lumped under the moniker of chemotherapy. And it's good for you to have a general overview of what chemotherapy is before you start on treatment. But you'll also need a specific review of the drug or drugs that you'll be taking, and that's the purpose of this video today. And specifically, you're going to be receiving oral chemotherapy or chemotherapy by mouth. Arguably, in the past, many chemotherapy drugs were given exclusively by vein, that is intravenously, and the doctor was able to monitor you during the treatment and frequently thereafter. With oral chemotherapy, or drugs given to yourself by mouth, pills in other words, you'll be giving yourself the chemotherapy. Well, that obviously presents some great conveniences. For example, you don't have to come into the office continuously for your treatment. But it also presents some unique challenges that we're going to produce this video today to help us overcome. For example, you'll need to monitor your side effects closely in conjunction with your healthcare team and make sure that your treatment with each chemotherapy administration is appropriate for the degree of symptoms you're experiencing. So much of this video is dedicated to discussing potential symptoms and side effects and making sure you understand those. Throughout this video, you'll hear the admonition that if you have any concern or symptom, to please call your healthcare team, and that's especially true with oral chemotherapy drugs, where you yourself are administering the treatment. If you have any concerns, please feel free to give us a call. Now don't worry, before you start treatment, we're going to review your pills with you, we'll review the appropriate doses, we'll review how to take the medication, should you take it with food or in between meals. Should you swallow it whole or chew it first? We'll go over all those issues with you ahead of time. To that end, I'd like to ask you to develop what I would call a patient treatment log. And probably not a monthly calendar, because there's not much room on each day to write in issues you might be having, but probably a log with 3 columns. One for the date, one for any symptoms you may be experiencing, and then probably a third one with some check boxes in terms of whether you're supposed to take the drug that day or not, and whether you actually took it by checking off the drug. That way, you can bring that log into the office during your office visit, and we can review that together and come up with some strategies to overcome any side effects you may be having. In addition, it's often a good idea when you're taking oral chemotherapy to get yourself a pill box that you can specifically use for just this medication, and you can put your pills in the specific days you're supposed to take them. That will serve as a visual reminder to you that you've actually taken the drug that you were supposed to take and that you've taken it accurately. Now, I'd also like to remind you, if you forget a dose, call your healthcare team. Don't double up on the dose the next day, because that was likely not a prudent thing to do. Now, before we go into the PowerPoint video, I want to review the concept of dose reductions. Dose reductions, that is reducing the dose of your treatment for significant side effects, is part of any protocol that we would ever offer a patient, and is part of the results that we quoted to you when you asked about the effectiveness of the therapy that we're proposing. All protocols, for safety reasons, have dose reductions built in to allow patients to safely have the drug administered to them without inordinate side effects. So don't be reluctant to call in with a side effect saying, well, they may dose reduce me and my treatment will be less effective. It may in fact be more effective to dose reduce you, because you'll be able to better tolerate the drug and sustain the treatment for a longer period of time. So call in with any side effect that you're concerned about, and we'll work through it. We won't dose reduce you inappropriately, but appropriate dose reductions are essential for the safety and the effectiveness of your treatment. Well, now we're going to go ahead and move into the PowerPoint presentation that talks about your specific treatment. And I'd ask you to put together a pad of paper and a pen so you can jot down any questions you might have during this presentation, because we're going to review in person with you this treatment before you start therapy. Now remember, this video will review side effects, which are especially important to be aware of when you're administering the chemotherapy drug yourself. And we also go over the biology of the drug. How does this drug work, and why does it affect my cancer cells more dramatically than my normal cells? Don't worry about remembering all the details of that. That's really just provided for your information and interest, and you won't be tested on it. So I hope you enjoy the video, and please, once again, write down any questions you might have so that we can address them formally. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to discuss Revlimid chemotherapy, otherwise known as lenalidomide. To best understand how chemotherapy works in general, we're going to need a brief refresher course on biology. Don't worry, we're going to keep it simple. Remember, all living things are made of cells, and the blueprint for how a cell in our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a brief video showing this process. So cancerous cells are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through a process called the cell cycle. And the cell cycle goes from a resting phase through active and growing phases, and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells, since the cancer cells divide faster and therefore don't have time to repair themselves prior to cell division. I'm going to show now a brief video on the cell cycle process. The scheduling of chemotherapy, therefore, is set based on several issues: the type of cancer, the rate at which the cancer cells divide, and the time at which a given drug is likely to be effective within the cancer cell cycle. And that's why chemotherapy is typically given in cycles. Cycles are simply another name for treatments, which are separated by time intervals. During that time interval, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects, which include low blood counts, mouth sores, nausea, and hair loss. How Revlimid works. Revlimid has multiple mechanisms of action, as you can see on this accompanying slide. It's actually quite complex and somewhat controversial. What we've worked out so far is that it does appear to work as an immunomodulator, affecting the body's ability to attack the cancer directly using your own immune system. It also has anti-angiogenic properties, and that means it affects the ability to make blood vessels and therefore affects blood supply to the bone marrow support for the cancer. It likely also alters signals that pass between cancer cells and within cancer cells, known as signal transduction. Once again, the mechanism by which it works is currently under great study. Now let's review the schedule of Revlimid. Revlimid should only be taken orally and at about the same time each day. It can be taken with water and should be swallowed whole. Do not open, break, or chew the capsule. The starting dose in the disease multiple myeloma is 25 milligrams once daily on days 1 through 21 on a repeated 28-day cycle. It is often given with a steroid, known as dexamethasone, 40 milligrams orally, and that's often given on day 1, 8, 15, and 22. Once again, other dexamethasone schedules are also used. The 25 milligram dose may be lowered based on blood counts or other factors, and the drug is given at 10 milligrams a day in the disease called myelodysplasia or the myelodysplastic syndromes. So graphically, as you see here, Revlimid is given for 21 days consecutively, and the Decadron or dexamethasone is given in this example on days 1, 8, 15, and 22. Once again, there are other schedules of Decadron that are used. This entire cycle is repeated every 28 days, so the final or fourth week of treatment, you do not take your Revlimid. Now let's review some side effects of Revlimid. Each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has Revlimid therapy. Constipation or diarrhea can occur. Constipation is more common and can be treated with medications such as Miralax as well as changes in diet. Diarrhea, however, can also occur with this drug with some regularity. Revlimid is associated with an increased risk of blood clots and pulmonary embolism. You should report any shortness of breath, chest pain, or arm or leg swelling. You may be prescribed medications that, quote, thin, end quote, the blood, known as anticoagulants. Rare skin reactions and liver issues have also been reported with this drug, and your blood studies will be followed while you're taking this medication. Blood counts, especially white cells that help you fight infection, may be reduced with this medicine. You should report any fever greater than 100.5 or shaking chill to your healthcare team. This medicine may also reduce your platelets, the blood clotting cells, and your red cells that carry oxygen. Nausea can occur with Revlimid, but this should be somewhat minimal. Revlimid, most importantly, is a potent teratogen that causes serious birth defects. Females of reproductive potential must use 2 forms of contraception or abstain from sex. The drug is also present in the semen of men who must use a latex or synthetic condom even if they've had a prior vasectomy. These precautions should continue while you're taking the drug and for at least 28 days after discontinuing the drug. Nausea prevention and management. As we mentioned, you'll receive one or more anti-nausea medications to take by mouth. If you experience nausea, take these medications immediately. Since they can cause constipation, you may need Miralax or another mild laxative. Zofran or ondansetron is usually taken 1 8 mg tablet every 8 hours as needed for nausea. This medication does not cause drowsiness and can be a good choice during the day. It can cause headache and constipation. Phenergan or promethazine is taken 1 tablet every 6 hours as needed. This medication can cause variable drowsiness. Ativan or lorazepam is taken 1 mg every 6 hours as needed. This generally does cause sedation and can be a good choice to take at night. Now let's review some commonly asked questions with regard to Revlimid. Will I gain weight with steroids such as dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of food you're eating. For example, avoid excessive desserts, salts, etc. Can I get manicures, pedicures, or massage therapy? Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures or pedicures, but you'll want to bring your own tools and avoid cutting cuticles. Avoid harsh skin scrubs also if you have skin sensitivity on the palms or soles of the feet. Massage therapy, however, is usually very helpful during treatment, but avoid deep muscle massage if your platelet counts are low. Are there any food restrictions? Avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements can be a healthy, attractive food choice in addition. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly with any dietary changes and focus on healthy, non-processed foods. That's always a good place to start. Should I take anti-nausea medications at home after my treatment? Well, this can be necessary, and we'll talk about that more during your office visit. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please therefore assemble a list of all the vitamins and supplements you're taking. In general, we like to avoid these during your treatment due to unanticipated reactions between the medications. They can usually be resumed safely after therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, ports can be required with continuous infusions of drugs, when there's poor or limited venous access, or when the drugs are irritating to the veins. The video at the end of this summary is going to provide an overview of ports for chemotherapy administration. So in summary, Revlimid is effective medication because there is a therapeutic window. In other words, the drugs are specifically designed to be toxic to cancer cells while your normal cells have the ability to recover from treatment. The chemotherapy treatment and supportive medications such as anti-nausea medications or shots to help your immune system are delivered at specific times during each treatment or cycle. The side effects of Revlimid are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. However, most importantly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That is really why we're here. Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than ½ an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you'll be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.